How does chemotherapy-induced neuropathy affect fine motor skills? Imagine trying to button a shirt or pick up a tiny coin and suddenly finding your fingers less coordinated or feeling numb. Chemotherapy-induced neuropathy can make everyday hand movements more challenging for breast cancer patients. This condition happens when chemotherapy damages the peripheral nerves that send signals between the brain and the hands and fingers. The nerve damage can cause symptoms like numbness, tingling, burning sensations, weakness, and problems with coordination. These symptoms can directly interfere with tasks that require precise hand control, such as typing, writing, or handling small objects. Research shows that women undergoing chemotherapy for breast cancer often experience a noticeable decline in fine motor skills. The most significant issues tend to occur during and shortly after treatment, especially when multiple chemotherapy drugs are used together. Both the dominant and non-dominant hands can be affected, leading to decreased grip strength and less finger dexterity. For example, a woman might find it harder to hold a pen steadily or open a jar. These impairments can last 4 months after treatment ends, impacting daily life and reducing independence. The nerve damage affects 2 types of nerves. Sensory nerves are responsible for feeling touch, temperature, and pain. When these nerves are damaged, patients may feel numbness or a loss of sensation, making it harder to gauge how much pressure they are applying. Motor nerves control muscle movements, and damage here can cause muscle weakness, cramps, or even tremors. As a result, muscle control becomes less precise, making delicate tasks more difficult and increasing the risk of dropping objects or injuring oneself. Managing these effects involves a team approach. Physical and occupational therapy can help improve hand strength, coordination, and sensory input. Early assessment before starting chemotherapy allows healthcare providers to plan supportive strategies. Ongoing monitoring helps tailor interventions to each person's needs. Simple home exercises, such as hand stretches or activities that stimulate finger movements, can support recovery. Using adaptive tools like larger grips or ergonomic utensils can also make daily tasks easier. In summary, chemotherapy-induced neuropathy can significantly impact fine motor skills by damaging nerves that control sensation and movement in the hands. This nerve damage can make everyday activities more difficult and affect quality of life. However, with early intervention, personalized therapy, and supportive care, many patients can maintain or regain their hand function over time. Always consult healthcare professionals for tailored advice and treatment options to best manage these side effects.